Hi, my name is Kathleen, and I'm an Accelerated Resolution Therapy, or ART therapist. First, I want to say thank you for being a volunteer assistant so we can continue this work and help our clients move forward. The purpose of this video is to show you what it will look like to be an assistant for administering eye movements. Hopefully this video will help you see ways you can position yourself, the participant, and the computer camera, as the therapist will need to see the participant's eyes throughout the session. Of course, the therapist will be coaching you from the other side of the screen, talking you through each step of the way. Also, you will be able to go through all of this information with the ART therapist before you start using the eye movement protocol in sessions. They will be able to answer any questions you have. We will go over 2 different methods that you can use to administer the eye movements. Both are effective, so it will simply depend on what you and the participant feel most comfortable with. In the next clips, I show what it looks like to use your hand to guide the eye movements. You can sit very close to the participant, or you can sit further away while asking the participant to follow your hand. Though it may have been hard to tell from the clips, in some of them I was at least 6 feet from the participant. You can sit 6 feet or even more back from the participant. If you are sitting further away, the participant will be able to tell you if they are getting too distracted by things behind you or around you in their visual range. The distractions just may get in the way of focusing on what the therapist is guiding them to work on. If this is the case, it might not be a good option for this specific participant. Next, I'm going to show you what it's like to use a tool that helps with physical distancing even more. This is a good option as well. I simply attached a note card to the end of a long stick. This takes a little practice, but it can be just as effective. Okay, just a few more tips before you practice putting this all together. The eye movements should be smooth and even. We want the iris of the eye to go from corner to corner of the eye. To give you a better idea, here's what my eyes look like while doing the eye movements. Again, the therapist will remind both you and the participant of these points before you start a session together. I'm just sharing in case it's helpful for deciding where and how to position for the session, and so you can feel prepared to begin. So just a few more things to keep in mind. As you can see in the clips, the participant will stay seated without any body parts crossed. The participant will keep their head and neck still, facing your hand or the eye movement tool, with just their eyes moving. It's also best if the area the client is facing is as blank as possible, like a wall without any art or decoration on it. It's best to not have any distracting jewelry on as well. When it's time to start the eye movements, you will hear the therapist say, "Begin." And when it is time to stop the eye movements, you'll hear the therapist say, "Done." We want the eye movements to be as fast as the client is comfortable with and able to follow. You will be able to practice different paces to see what the participant is most comfortable with. If the participant's eyes slow down or stop, you'll slow your hand to catch their eyes. And it's okay to say something like, "Keep following my hand," to remind them to keep moving their eyes. If their eyes close, please remind them to keep their eyes open and to follow your hand. Even if emotions get strong, we do not want to stop the eye movement set until it is time to do so. Again, when the eye movement set is complete, you will hear the therapist say, "Done." We need the participant to stay at the screen and to not leave the room, even if it becomes hard. Of course, the therapist will also be able to help remind them and encourage them along the way if needed. Though you, the therapist and participant, will go over this together, I thought it would be helpful to go over some of these points in advance so you can be prepared, have time to ask questions, and increase your own comfort in being an assistant by seeing what it will look like. Feel free to practice moving your hand or the stick with the card. I have practiced my own hand movements by having my hand close to a wall, keeping it as flat and straight along a horizontal line as possible, instead of what the developer of art refers to as the windshield wiper. Again, thank you for your willingness to be a volunteer assistant, administering eye movements. This is truly great, as without your assistance, we wouldn't be able to continue doing art, an amazing and powerful method to finding true resolution. Thank you again.